I'm Dr. Michael Berry, President of the Foundation for Informed Medical Decision Making. We believe that patients should be fully informed and participate in their healthcare decisions. The decision to have a PSA blood test to screen for prostate cancer is an important example of the need to be informed and participate in your healthcare decisions, and I'd like to explain why. Most people think of the PSA as a simple blood test that could save your life. The reality is more complicated, and research shows that the PSA test is far from perfect. Understanding the issues involved with prostate cancer screening and the steps that can follow a PSA test is knowledge all men should have when making this decision. A man in the United States has about 3 chances in 100 of eventually dying of prostate cancer, which means 97 chances in 100 of dying of something else, like heart disease. The chances of dying of prostate cancer are higher for African Americans, about 5 chances in 100. The chances of dying of heart disease are much higher, about 20 chances in 100 over your lifetime. We've learned that the PSA test just isn't that accurate. Elevated PSA levels don't always mean a man has cancer, because some benign prostate problems can raise the PSA. On the other hand, many men with low PSA levels do have prostate cancer, so a low PSA level isn't a guarantee you don't have cancer. Because of this uncertainty, there's a lot of controversy about how high a PSA level needs to be before the next step needs to be taken, a prostate biopsy. The PSA itself can't make a diagnosis of prostate cancer. It's the biopsy that diagnoses prostate cancer. For a biopsy, a doctor puts an ultrasound probe in the rectum, which lies just behind the prostate, to take 12 or so needle biopsy samples from the prostate. The biopsy test can be uncomfortable. No one would want to go through it if they didn't have to, and can be complicated by bleeding or infection. If cancer is found, treatment needs to be considered, which I'll talk about in a minute. So how does the PSA test affect your chances of dying of prostate cancer? Although results aren't all consistent, a large study in Europe has suggested that men who get regular PSA tests might lower their chances of eventually dying of prostate cancer from about 3 chances in 100 to 2 chances in 100. Whether that sounds like a big or small benefit is really up to you. That's the possible benefit. What are the possible downsides, beside the chance of an inaccurate test result or having to go through a biopsy? First, men who get regular PSA tests have a much higher chance of having to face a diagnosis of prostate cancer over their lifetime. In fact, regular PSA tests increase your risk of being diagnosed with prostate cancer from about 10 chances in 100 over your life to about 20 chances in 100. How's that possible? Well, it's not that PSA tests actually cause prostate cancer. The problem is many older men have small cancers in their prostates that will never grow enough to ever cause problems. The PSA test finds those harmless cancers as well as some of the important ones. And once they're found, it's hard to tell the two apart, so all men wind up facing the choice of treatment. That means many men will be treated for a cancer that never would have bothered them if they hadn't had a PSA test. So let's talk about treatment. If prostate cancer treatment were without side effects, there'd be a lot less controversy about PSA screening. Unfortunately, that's just not the case. Treatments for prostate cancer can cause some serious side effects. The most common treatments for prostate cancer are surgery or radiation. With both treatments, many men experience problems with control of urination and trouble getting erections for sex. So it's important to consider all the pros and cons when making a decision about the PSA test. I encourage you to learn the facts and work with your doctor to make the decision that's best for you. No one answer is right for everyone.